Hello and welcome to this week's episode of Giant's Healthy Innovators Live TV. I'm your host and my name is Barry Shrier, and I'd like to say thank you to the many tens of thousands of viewers who tune in to watch our weekly episodes featuring some fabulous innovators and scientists and academics and business people who are all at the forefront of creating the latest healthcare technology innovation and improving healthcare all around. To begin with, I'd like to say thank you to our sponsors. We have Grovelands, who are an international management consultancy and recruitment business. Thank you to Grovelands for your support of Healthy Innovators TV. And we also have Tech Data, who are a global IT distributor and support company. So thanks again to Grovelands and Tech Data for your valuable sponsorship. We appreciate that. I would also like to mention that these episodes are sponsored by the Giant Health event. Giant is Europe's largest and most established healthcare innovation technology event. We gather thousands and thousands of people together every year, and this year the event is from the 15th to the 16th of October here in London. So if you're involved in healthcare or technology or innovation, we'd love to see you. The website for a Giant Health event is www.gianthealthevent.com. So we look forward to hearing from you. So this week we have some fabulous guests. Thank you very much for joining us, Keith and Bijendra. Nice to see you guys. As you know, the format is I'd like to ask you guys to introduce yourselves, please, and to talk a little bit about what you're doing and what some of your interests are in healthcare. And then we're going to have a general conversation about how to move forward with adopting new innovation, how to accelerate healthcare to deliver better outcomes. We all share one vision, which is to improve the health and the well-being of people around the world by supporting innovation and facilitating health tech entrepreneurs. So it's great to have you guys on the show. Thank you very much. So Keith, please, if you don't mind, if you can introduce yourself and tell us a little bit about what you're doing.
Sure. Thanks, Barry, and thanks to Giant. It's great to be here. So I'm Keith Errey. I'm the CEO and co-founder of Isansys Lifecare Limited. And Isansys is a business where we are really automating one of the basic processes of healthcare, and that is knowing what a patient's physiology actually is, what their physiological status is.
Excellent.
In the hospital, it's called taking OBS, and that is done either by nurses working manually or sometimes done with machines by the bed. And what we have done is not only automate it, but make it wireless, so patients can have all their data taken all the time and be totally free, be totally able to walk around without the tyranny of cables and wires.
That's super. Yeah. Great accomplishments, and congratulations on what you've done so far. And Bijendra, nice to see you. Haven't seen you in weeks, have I?
I know. We were not so long ago in Sofia.
Exactly. Yeah, anyway, but thank you for joining us. So if you could help us to introduce you and let us know what you're doing these days.
Yes, thanks for inviting, first of all, Barry, and thanks for Giant. I'm an NHS consultant, as you know, and academic surgeon. So my role is clinical practice as well as university education.
Okay.
And I'm also medical director for a startup tech company called Medical Realities.
Oh, okay, excellent.
Which is where we are using technology to disrupt surgical education. It takes about 15 years to train a surgeon.
Wow.
And in any medical school, you can have 3 or 4 medical students attending an operating theatre to watch me operate and learn.
Okay.
So you can imagine if it takes 15 years to train a surgeon, if we have to sort of improve our workforce training and education and efficiency, it is going to be challenging.
Yes, absolutely. And I guess it's not scalable, is it? If you have 3 or 4 students who are in a theatre watching you, how do you do that times the requirement for training many thousands or tens of thousands of students?
Well, the answer is virtual reality.
Yes. So this company is called Medical Realities. And do they have a website?
They have a it's medicalrealities.com.
Okay. And tell us more about that, because that's fascinating.
So what we are doing is we are recording the entire operating theatre and the procedure in VR.
Okay.
And using your mobile phone. So all you need is download the Medical Realities app on your mobile phone.
Right.
Any VR headset you can put it on, and you can straight away enter the operating theatre.
Wow.
So any number of people can enter the operating theatre and learn from expert surgeons. So
any number.
Any number.
So you could have 25,000 students overseas participating in this exercise.
The global, if I'm right, the global mobile phone penetration is about
2 or 3 billion or more.
Yeah, so
Yeah.
they can all tune in.
Magnificent. Yeah. That's the promise of technology,
That's the
I suppose,
technology.
is technology,
That's the
is scalability. But there's challenges, aren't there? So, for example, with your business, what kind of challenges have you been experiencing in your journey?
Well, I think it's actually related to what we've just heard from Bijendra, that the time it takes to train somebody in the medical profession,
Okay.
particularly a doctor or a nurse, is very long. So it's quite difficult to come along with new technologies and then expect people who've had 10, 15, maybe more years of training to throw away what they were doing and adopt something new.
Yes.
And because, in a very real sense, we as patients or as healthcare consumers are giving those people life and death decisions over us.
Yes.
So it's quite serious stuff. So it's
Yeah.
not easy then to say, I'm going to try something new.
Sure.
And
It'd be a
relate.
bit scary as a patient, wouldn't it?
Oh, very
if
much
the
so.
clinician comes in and says, well, I haven't used this widget before, but I'm going to trial it on you.
Exactly. But if that new widget is able to be part of a VR-based training program, for instance, things like that will be able to speed the adoption of new technologies, which will be fabulous. Yeah. Interesting stuff going on there.
Oh, absolutely. And this concept of digital paradigm, I'm not sure how old you guys are, but I'm very old, and I guess I'm, what do you call it, a digital foreigner. And the youth of today are the digital natives, aren't they? They grew up with smartphones and whatever. And so this concept of digital paradigm, I guess, could be coming on stream. Maybe young medical students these days are a little more familiar with these technologies than the elder senior consultants, and I don't know if that will have an impact. Is medical education quite diverse around the world, and is there a role for immersive technologies to level things out or to create greater opportunity there?
Yeah, I mean, just like medical practice, the medical education is quite diverse.
Okay.
And one of the reasons why it takes so long is it's still classroom-based education, lecture-based education.
Right. Old
which
school.
is old school.
Wow.
Not engaging, not immersive. I'm sure we all know what we do if you're sitting in a lecture room.
Yeah,
Sort of
I used to
playing
sleep
with
when I was at uni.
we are either
Yeah.
sleeping or now we are sort of on your phone.
Yeah.
So we thought, why don't we use the mobile phone
Right.
to educate people and immerse people?
Yes. And
So, if you look at the learning pyramid, your knowledge retention from lectures and reading is about 10 to 15%.
right.
Whereas if you're immersed in education, your knowledge retention is going to be about 50, 60%.
That's
So it's a
extraordinary.
no-brainer.
It's a huge difference.
No brainer.
So for the average student, if they're using whatever, virtual reality goggles,
Yeah.
they're going to learn 3 or 4 times more in
Faster.
terms of retention
Faster.
than if they're reading or sitting in a lecture room.
Correct.
That's profound.
And not only doctors, I mean, the whole equation translates into faster education within healthcare.
Yes.
So whether it's doctors, nurses, allied professionals, you can really speed up and disrupt the old-fashioned lecture-based education.
Yes. And I suppose, what's the word for it? Upgrade it.
Upgrade.
Like with a
Upscale.
Tesla car, you can just upgrade it
Upgrade.
over the air
Yeah.
instantaneously. Whereas with an old automobile, you can't do that. So maybe with educational programs, they can be instantly
Just instantly
upgraded.
upgrade that.
Yes. Fascinating. No, it's to me, it's a really exciting future, albeit plenty of challenges. And in terms of some of the technologies that you guys have developed, I mean, would you call yourself what? Is it an intellectual property business? Are you a hardware maker? Are you a service provider? With medical realities, it's more of a player in a bigger ecosystem. You're not making goggles.
We are not making
or,
goggles. No, I think
Is it a content business? How do you define it?
it's a content business. So recording, let me give you an example how we've sort of reached here. Surgical simulation, so training surgeons using simulators,
Right.
box trainers, simple cheap simulators. Now, laparoscopic surgery, as you know, your keyhole surgery, you make tiny incisions in the abdomen,
Okay.
put in a camera, an
Yeah.
instrument, then you're looking at a standard flat screen monitor and operating it.
Oh, okay.
So
We should have done a demonstration.
we could have done
next
that,
time.
exactly, next time. But now if I tell you that, obviously you know the benefits of laparoscopic surgery, it's less pain and early mobilization and cost effective and everything else.
Okay.
But the limitation is that a surgeon is looking at a flat screen monitor which is 2-dimensional.
Oh, right.
And your human anatomy is so complex in 3D.
Yeah.
So the first thing that you have to learn as a surgeon is to sort of give up all the 3D knowledge.
Because you're looking at a screen.
You're looking at a screen and you're working with long instrument. So about 15-20 years ago, the surgical education, as the laparoscopic surgery began to evolve, and as the training got more and more sophisticated, we realized that we don't need to learn on patients, we don't need to learn on humans.
Right.
Hand-eye coordination, depth perception, all this you can learn in a simulator.
Oh, how extraordinary.
So just like flight simulators, I mean, you don't fly a plane straight away.
No.
You sit in a flight simulator. And that's how it started. Now with medical realities, we are recording the whole operative procedure.
Right.
And as you know, the surgical training is still an apprentice model where you see and watch a senior surgeon and you learn from them.
Okay.
And then you sort of get your hands dirty, so to say. With technology and haptics, so we have to integrate haptic gloves, and you can actually virtually start doing things.
Amazing. That's fabulous.
So you can see how well you could be immersed in an operation, even as a novice.
Yes, that's superb. Could you help our audience, because we have some terms sometimes which aren't necessarily things that everybody who's watching the show will be aware of. You mentioned haptics, so if you could define that to people who haven't heard about that before.
So touching and feeling. So in the simplest form is to be able to touch and to be able to feel. When you're doing operation, it's quite critical to be able to touch and feel the organ.
Okay.
And when you're operating without haptics, it's almost like sort of working in 2 dimension with a lot of limitation and no touch and feel. So making your whole job held back, making it a lot more risky.
Okay. And what is a haptic glove, and how does that work?
A haptic glove, you'll sense and you'll feel the simulated body and the tissue that you're trying to handle, where you're trying to operate. So it'll be a very realistic feel in a virtual space.
Fascinating, absolutely fascinating. I guess the latest smartphones have a slightly more advanced haptics than the original ones. First you just had vibrate, didn't you? But now I kind of feel the sort of left-right vibration and things like that, which is fascinating, isn't it? And it's just another layer of information or another level of communication. This has, I guess, a couple different kinds of buzzings or zappings. Of course, I ignore them all, especially when it says every hour stand up and breathe, and all these other healthcare nudges which aren't quite there yet. Are there any issues for you in terms of, I was just reminded of the big global players, what are they called? FAAG, the big largest tech companies in the world that seem to be in control of everything now. Does that impose itself on you guys? Are there risks that, who knows what, Facebook or Amazon or Google might say, well, we'd like to do what you're doing. We think we'll just push you out of the way. Or is it so specialized? What kind of issues do you find in that area?
There's always risks. There's always risks, and I think anybody who's working in tech needs to be aware of that. But I think what we have done is, I don't think where we are in the sort of pyramid or triangle of care is going to be where those guys go.
Okay.
So if you look at the triangle, can be drawn in various ways, but we have tertiary care, sort of top of the triangle. That's like critical care in a hospital. You have secondary care, which is like clinical care under that. Primary care, everybody's aware of primary care, your GP and so on. And then there's this other new, really interesting area that you explore often on this show, Barry, which is consumer healthcare. And that is very much bigger. So in terms of numbers, you have like numbers where expanding towards the bottom of the triangle, right?
And those global players.
And the global players are there because the numbers are big. And the other interesting thing about that is that the further you go towards the top of that triangle, the more difficult it gets, the more regulated it gets, and it's also a smaller market. But it's a higher margin market, and it works better to approach that if you're a smaller company than to try to go straight into that big consumer health market as a player.
Well, that's fascinating.
So it's about thinking about how you structure your business with the technology there.
No, that's a helpful clarification. Thank you for that. There's that graph, isn't there, about the different types of medical care one would get, like primary and then secondary and then whatever emergency or critical, and the cost of that.
That's right.
And how naturally in society we want to move people as much as possible away from expensive acute care to long-term look after your own care.
Absolutely.
And I suppose maybe there's a little bit of analogy in medical education. Anything we can do to figure out how to reduce the costs of medical education are similar. So you want to move them from that top left expensive corner of the chart to the bottom right inexpensive corner. And again, perhaps this is where things like immersive technologies have a big role to play. It's not the, what do you call it, the apprentice model, which is, I assume, the most expensive.
Most expensive and not scalable, longest. In terms of delivery of healthcare and education, by combining technology and machine learning, you could provide a lot of your basic healthcare. I mean, what do we do today? Most of us, before we see a doctor, we Google.
Exactly. Yeah.
So why, once we have an intelligent Google who can be your doctor,
yes,
you will have everything at your fingertips.
Yes, that must be very difficult for clinicians. If a patient says, well, I know what's wrong with me because I've Googled it, and the clinician says, well, I've had 25 years of expert training and experience in this.
Well, in fact, in my practice, I first ask them, what have you learned on internet? So
really?
Tell me. Well, so that I can counsel them better. So I know where they're coming from. I know what sort of ideas they have in their mind.
Okay.
So
yes, the good and bad of technology.
The good and bad of technology. There's no point in shying away.
Yes.
It's there. We have to face it.
Well, exactly, and that's not going away. In fact, it's probably the opposite, isn't it? In terms of the impact of access to information and consumer engagement and that type of thing.
And could those systems be used for consumer training as well, like us as consumers, as just ordinary people? Can we learn more faster about how to look after ourselves in that way?
Correct.
Do you think?
Yeah. I mean, I'll give you another example. Basic life support training. I mean, you must have heard it in the news recently that they want even the London taxi drivers to be competent and trained in basic life support.
Yes.
And if you, or if anybody had a heart attack in the streets in UK, your chances of survival is about 10%.
Oh dear.
Whereas in Denmark, it's 40%.
Because
it's, as you mentioned, education right from the primary school level.
I had no idea. That's fascinating.
And even the Department of Education in UK has recommended basic life support education and training from school, primary school, secondary school. Now, virtual reality is where we step in. If you so there's a virtual as an educational tool. It's immersive and engaging. So we have a virtual reality basic life support training model, which takes 20 minutes to train. Whereas if you go to attend a course, it takes 4 to 6 hours of your training.
It's a whole
session, half a day, a whole session. So over here, you would get just like playing your Xbox or any video game.
Amazing.
You get the kids into VR environment. Teach them basic life support.
Yes.
Don't need to go to medical school. Don't need to do anything. And you could suddenly improve your survival from 10% to sort of 40% if you want to have
enormous.
That's huge.
From 10% to 40%. And could that happen with one 20-minute virtual reality session?
It's
or
repetition.
Series of them?
Series of them.
And what would that include? What are some of the basic life support or
it's
rescue?
Just sort of having your compression, compression only resuscitation.
And that's
we call
all.
it. That's all. So if somebody were to collapse, all you need to do is obviously make sure that the environment around you is safe and start compression. So that knowledge and training you could get in 20 minutes using a VR headset.
Extraordinary. Therefore, accessible to everybody.
Exactly.
And a huge impact on the well-being of the nation. What a great story. So we've spoken about a bunch of extremely interesting subjects, and we're going to wrap up now. But it's been absolutely fabulous to have you guys on the show. Thank you very much. And I'm also grateful for you to share with us the extremely interesting and important tech innovations that you guys are developing. No, but thank you very much. Really interesting. And
thanks, Barry.
We're grateful to have you on board, and also very proud of what you guys have accomplished, a valuable contribution to healthcare.
Thank you.
So thank you for that.
Thanks.
And likewise, Bijendra, if you want to summarize with anything or vision of the future, what are you guys looking to do?
In terms of vision, I think what Keith is doing is fantastic, and won't be long before you'll have lots of medical devices or appliances integrated into, you might walk into PC World and just sort of buy a medical pod.
Yes, yeah.
That will do your initial assessment and diagnostics. In terms of my personal interest and ambition with medical reality and education is to democratize. So change the way we select and train medical professionals.
Yes.
It should not be just based on 3 A stars.
Yes, exactly. So, which arguably could be quite an elitist system, couldn't it?
Yeah, it is. It should not be a privilege for few. It should, democratize the whole process.
Yeah, exactly.
Disrupt using technology.
Yes, and immersive technologies actually have a very central role in delivering that and allowing us to achieve that very attractive destination.
So I mean, through medical reality, we are at the stage of creating a virtual university, if we can call it.
Wow.
And looking to attract funding so that I can have a completely disrupted pathway for medical education. Similar to the new technology engineering college, which exists in Hereford.
Yeah, exactly. What a great story and a fabulous ambition. So thank you very much for sharing that. Again, great to see you guys. And we're grateful for you joining the episode today. So thank you very much. Once again, my name is Barry Shrier, and you've been watching this week's episode of Giants Healthy Innovators Live TV. We'd like to thank our sponsors once again, Grovelands and Tech Data, and we're also very grateful to Disruptive Live, who are the world's best television production team. Thank you to the team here at Disruptive Live. We appreciate your support. Lastly, we'd like to thank our sponsor, Giant Health. So Giant Health produces Europe's largest and most valuable international event celebrating health tech innovation. The Giant Health event brings together many thousands of people from all across Europe and all around the world who are all actively involved in innovating in healthcare to deliver better healthcare outcomes. This year, the Giant Health event is from the 15th to the 16th of October in London, and the website for that is www.gianthealthevent.com. So if you're interested, please visit the website and you can learn more. Thank you very much, and we hope you enjoyed this episode. Looking forward to seeing you next week.